group, and if you do have to sneak out early, I know there are a couple of you who do. I am totally not offended. I'm just very glad that you're here. And then the lecture is projected to be a little shorter than the normal over here. It should be 30 to 40 minutes so that we could have a little time to talk afterwards. But anytime if you need to run out, that's fine with me. So you can get cozy if you want to. So after we finish, good. Okay, it's okay. I would do the same if I could the whole time. So I'm Cheli Reutter, professor of field service, professor in Africana Studies. I have taught in English also and African American literature at the University of Louisville. I was a Fulbright scholar in Freiburg, Germany in 2006. I've been interested in the medical humanities for several years. I piloted a face-to-face medical humanities class here in 2007 for the College of Arts and Sciences under the tutelage of Terry Primo, who's now a professor over in Allied Health Sciences. And I've also taught a multi-section online medical humanities class for clinical laboratory sciences in the summer of 2008 and again in the summer of 2009. And I continue, while I do not identify myself as a medical humanist, I think this is important to note that there are many of us who do medical humanities work. And part of the objective of this talk is whether or not you are a medical humanist, whether or not you're a public health professor, or any sort of identified scholar of that sort, if you have contributions to make to the medical humanities. I encourage self-identification. I'm also just happy for anybody who is here who's just simply interested in what medical humanities is about, and about medical humanities, about our involvement, official and unofficial, in the medical humanities here at UC. A medical textbook will tell you about the anatomy of a person, but if you really want to understand the human condition, how people feel about themselves, their lives, and their illness, then you are better off reading the poems of William Carlos Williams or looking at the paintings of Robert Pope. This is a quotation from Robert Murray, quoted on the University of Texas Medical Branch Institute for Medical Humanities website. So in the first section of my talk, I'm going to illustrate by example what is the medical humanities. Case 1. A midwife who works in a village hospital for many years finds that the women who have many family members visiting them at the time of their baby's birth report feeling much less pain than women who have only a few visitors. Case 2. A newspaper woman in Cincinnati shaves her head into a mohawk and dyes it pink before going for her first chemotherapy treatment for her stage 3C breast cancer. As she faces radical treatment, including radiation, chemotherapy, and a newly approved drug regimen, she is cheered on not only by family and friends who have known her for years, but also by the guys at Bruegger's who fix her coffee every morning, who appreciate her satiric humor. Case 3. An English professor who is an expert in the poetry of John Donne finds comfort in nursing care, popsicles, and her now retired dissertation director's tender rendition of the children's story, Goodnight Moon. Case 4. A child who is conceived by in vitro fertilization as a donor for her sister who suffers from a rare form of leukemia sues her parents for her rights to her own body. These stories may not seem to have much in common, but there is a unifying principle. All address themes of health, healthcare, and illness in wellness communities. All of these stories, whether fact or fiction, and you will get to find out which is which in a moment here, are based at least on some level on real-life medical issues and situations. These are just a few of countless examples of the stories told around health or healthcare experience. Not the science of medicine, but its narrative. Not the protocol of medicine, but its politics. Not matters of physical, but of metaphysical or spiritual well-being. The real question with stories like these, and the countless others in life, literature, and film, which can be said to comprise the field we as the medical humanities is not how we can relate to such texts, so much as what may be the purpose for a formal study of these texts collectively, and what communities or constituencies are best served by such study. These questions I address in this talk. So here I would like to note how the practice of medical humanities is an organic and natural part of the human experience. I said at the beginning of the talk that I am not a medical humanist. As a scholar, I am not, but there is a level on which we all are. Two of the examples I give are personal anecdotes and serve more informal oral or storytelling communities. The midwife story is passed on by Professor John Kalubi about his grandmother's experience at a hospital in Zambia, a story expressive of the healing power of family and community, not just surgery and medication. The pink Mohawk woman's story also circulates in a community of family and friends. The woman is my sister Catherine, who is now cancer-free and Muslim-free. Catherine preferred not to wear the turbans popular among women undergoing chemo, although she did go hat shopping with me once, and actually would wear her hats around me so that people would think that we were sisters. The joke is that if you know me well, you know I'm a woman with many hats. So it was not me who was sort of doing this sort of patronizing gesture towards her. She was coming around to me and embracing me in that way. She, in fact, was humoring me. The joke was on me as well. Needless to say, the hats she chose were striped with pink, her most hated color, all as a matter of thumbing her nose at the pinkness of the breast cancer activist culture. This pink mohawk and goofy hat-wearing humor was, for Catherine, the best way to cope with her illness experience. Humor can dissolve boundaries of isolation or replace undesirable connections between the so-called patients and others in the community. In Lacanian terms, the patient risks becoming an object of the gaze, a connection of the pitier to the object of pity. Catherine chose instead to act as an agent in the telling of her own illness story by writing a humorous commentary on her own body. And just a few days ago, I saw on the internet there was a story of a woman who had undergone several surgeries for cancer and tattooed her body as a way of reclaiming that. So here in this next section, I discuss examples from my own involvement in medical humanities at UC as course director for issues in medical humanities through the Clinical Laboratory Sciences Department, as instructor for the pilot course in ANS, and now more currently as a guest lecturer for Professor Joanne Langeville's freshman seminar. In literary rather than oral examples, humor may be replaced with wit, but still accomplishes roughly the same purpose of preventing readers from viewing characters with illnesses through a sentimental lens. The community, meanwhile, is not a community of association, but of readership, or, when used in curriculum, more specifically, a community of common educational goals. With the facilitators and the roughly 300 students I served in the CLS class, I wanted to get at the theme of wit, as well as many others affecting quality of life, patient care, Afghanistan community. Margaret Edson's 1996 play Wit was strong in its accomplishment of these goals. Just out of curiosity, is there anybody who's familiar with the play or the film with maybe the film with Emma Thompson in it too? She's absolutely stunning. So when I met Vivian Barry, the English professor from the given examples, I was not used to reading illness narratives in context of a reading audience other than